I'm going to talk about people with special conditions and how, as a personal trainer, we train these people. The first condition is high blood pressure. High blood pressure is a force of blood pushing against the artery walls as it goes throughout the body, and which put a lot of pressure on the arteries, and it can cause a cardiovascular disease and in some cases even stroke. So we have to be really careful about these people with high blood pressure. The first thing we have to consider is we have to have a clearance from the physician, and we have to make sure that they're okay to train. Second, if we want to do the strength training with them, if they want to do strength training and they want to get a little bit stronger, we have to use a moderate intensity. We have to really be careful about the intensity of their exercise and choose exercises with the repetition between 12 to 15. And for cardio, we have to use only moderate cardio, no interval training. Interval training is not a good option for these people because that's when the blood pressure increases and the heart rate increases, and which is not a safe option for them. And even when they do the any like aerobic exercises, when they do aerobic exercises, they have to be able to breathe briskly, and 30 to 14 minutes a day, 3 times a week is enough for them. And as a personal trainer, we have to still observe these people and be very careful if we see any symptoms of faintness or numbness in the limbs, or if they feel a little bit dizzy. We have to stop the exercise and let them rest. The second condition is lower back pain. A lot of people, 70 to 80% of people suffer from lower back pain. It can be caused by a lot of things. One of them might be just muscle strains, ligament strains, or even non-specific back pains, or herniated disc, and other problems like they might want to strengthen some other areas. It might be because of the weakness in their glutes, or the weakness in other areas of the body, and when they do some sort of exercises, they compensate with their lower back, and that's why they do have the problem. So what we have to do for these type of people is, for example, use the exercises that doesn't put pressure and put load on the back. For example, instead of using dumbbell row or barbell bend over row, we can use bench for them, and they can lean against the bench, or they can use seated row for strengthening their back. And just for other exercises, we just have to make sure, like for example squats, deadlifts, we should avoid squats, deadlifts, other exercises that put pressure on the back. And just make sure, even when they perform other exercises, we have to make sure that they engage their core. The core is always tight and rigid, and the breathing is always proper. The third condition is knee injuries. Knee injuries can be caused by a lot of different reasons. Some might be tendon tear, ligament tear, or patellofemoral pain syndrome. A lot of times it might be because of weakness in other areas, as I said before, for example, or tightness in some other areas. For example, if the rectus femoris is tight, it put pressure on the knees, and that's where people get their knee injuries from. As a personal trainer, we have to understand what causes the problem, and but during that time, while we might be able to fix the problem, we should avoid some exercises that put pressure on the knees. For example, instead of lunges, we can use step ups with a very short step, so it won't put pressure on the knees. Or for strengthening the leg, we can use other exercises, like for example side leg raises, or straight leg raises, or even in some cases, depends on the pain, in some cases we can use box squat instead of the full squat because it put less pressure on the knees.